Good morning and welcome to Michigan Matters. D-Insurance. It's the name of the legislation introduced in Lansing with the goal of addressing the skyrocketing cost of auto insurance in Detroit. Mike Duggan's a fan, as is Governor Snyder. But there are those who will say it won't change things and won't decrease prices in a meaningful way. We have people on both sides of the conversation here to talk about it. Then the roundtable of L. Brooks Patterson, Keith Owens, and Charlie Beckham is on deck to talk about the city, the region. So grab some coffee and join us as we discuss D-Insurance and more today on Michigan Matters.
From CBS 62, this is Michigan Matters with Carol Cain.
And we're happy to welcome Eric Poe, COO of Cure Auto Insurance, who is supporting D-Insurance, and David Christensen, principal of Christensen Law in Metro Detroit here in Southfield, who is against it. Gentlemen, thank you so much for being here. Appreciate it. There's so much to talk about on this, so let me talk to you, Eric, since you have been working with Mayor Duggan, trying to get D-Insurance approved, and why? Why does it need to change?
Well, because basically Michigan is in a dysfunctional market. We have 60% of all the people in Detroit that are not able to actually afford car insurance. And when there's an agenda to try to reinvigorate a city, they really have to make it affordable for people to live in the city.
So, David, what's wrong with that?
Well, I think that something does need to be done to help make it more affordable for people in Detroit. The problem with this proposal, there's, first of all, no guarantee at all that it will lower premiums. Second, it will provide with Detroit citizens with substandard health care. And the insurance policies that they're proposing are basically almost no insurance at all.
Yeah, and Eric, I know you have a chart where you talked about the rates in Michigan's, the insurance rates were skyrocketing compared to all other states. And why is that?
Well, basically because right now Michigan is one of only 12 states in the country that have no cap, meaning that that has no fault insurance with no cap, meaning that out of all the states, there's only 12 states that have no fault. Michigan's the only one in the entire country that says insurance companies, car insurance companies, have no limit to what they have to cover. It'd be like buying a life insurance policy without having any limit whatsoever. So when there's a claim and there's abuse, you have insurance companies that lose so much money they can't afford to do anything except for pass it on to the people that live in the city.
Where is the abuse coming from?
From healthcare providers. So basically there are two components of what drives these costs. One of them is it medically necessary to treat people? And then what are the rates? Right now in Detroit and in Michigan for the whole state, you basically have a limit of whatever is reasonable is whatever any healthcare provider automatically gets entitled to be paid for. So that's why they're abusing the system, and the average claims in Michigan are well above anywhere else in the whole country.
I know when Mayor Duggan announced this plan last spring, a lot of people were applauding because everybody knows the rates in Detroit particularly are just astronomical. And as you point out, 60% can't even afford to get insurance, even if they wanted to necessarily. I know, for example, AAA Michigan was inundated with people who were calling up thinking it was already a done deal and they wanted to partake of it. So what do you do then for this? I mean, if not D-Insurance, what is the solution here with this?
Well, I think the first solution that can probably lower rates dramatically overnight is to make it illegal for the insurance companies to engage in discriminatory pricing. The redlining is what drives the prices up in Detroit. You know, it's very interesting, the Angoff study that was done a few years back, but Jay Angoff did a study on the profitability of auto insurance industry in Michigan, and they showed that for the same person applying for Michigan insurance in Detroit, some companies sold it for $5,900. Other companies like Geico sold it for $2,300. So there's a $3,000 difference for the same product. I think profits are driving it.
Are you familiar with the study, Eric, that he's referring to?
No, but I am familiar with redlining and discriminatory practices, which he alludes to. I agree with you. First off, the insurance industry needs some accountability on their socioeconomic discriminatory, pricing. But that goes beyond what is the major problem in Michigan and Detroit. The fact is that there's a baseline cost that every auto insurance carrier has to pay because of this unlimited cap. So one way is, yes, how you're charging everybody, but the other way is just look at the cost. There's no cost containment right now, and that's why you need a choice. This bill is just a choice. If you want to have the mink coat, you want to have the no-fault unlimited policy, keep it. This is just you can't sit there and say everybody's got to buy a mink coat when 60% of the people are freezing outside and they say, I can't afford the mink coat, can you just give me a jacket?
If the D-Insurance, let's just say for the sake of discussion, D-Insurance, unlike the Rose, which finally got some sort of movement there, but the D-Insurance, which has been sitting up in Lansing for some time, gets some movement, who will take advantage of this? Do you have any research from your previous dealings in New Jersey and other places?
Well, definitely the people who don't want to drive without insurance. I mean, one of the things that people don't understand is not only if you're one of those people that can't afford car insurance, not only are you breaking the law, but you're actually prohibited from getting medical coverage paid for under state law of Michigan.
So someone who has no fault is in a major auto accident and has hundreds of thousands of bills.
Not paid for. If you have a liability car, if you have a car and you don't buy car insurance in Michigan, you're prohibited from even getting this unlimited coverage. You have to go to Medicare. And the second and worst part of it is if there's somebody who's negligent and hurts you, the richest person in the world, Donald Trump, could rear-end you tomorrow. In Michigan law, if you don't have liability insurance on that car, you're barred from actually suing and getting your pain and suffering back.
So, David, you agree that something needs to be done on the auto insurance front as far as making it more affordable for people. What's wrong with de-insurance, which, as I understand this, at least gives you a choice of going with it or not going with it?
Well, the insurance does give you a choice. People do not understand the benefit of no-fault insurance until they're in an accident. Most of your viewers probably haven't thought very much about it at all, but until you're faced with a catastrophic injury and your life is completely changed, then, it's only then that you realize the value of this insurance. It's the best insurance in the United States. The de-insurance will become the worst insurance, the worst no-fault insurance available in the United States. The lowest coverage, $25,000 for an entire family.
Yeah,
That's it.
And I know we've got a lot more to say about it, but we need to take a quick break here. We're going to pay a few bills, and we'll be back with more Michigan Matters and our conversation about de-insurance after this. Welcome back to Michigan Matters, where Eric Poe, COO of Kier Automotive Insurance, is here, as is David Christensen of Christensen Law Group. And Eric, I know you almost jumped out of your chair there as we wound down the last segment. You wanted to comment. Yeah,
well, I mean, to say that it would be the worst insurance is, in my opinion, misleading. First off, if the bill was passed, it would be $25,000 per person. It's not $25,000 as an aggregate. That $250,000 additional catastrophic layer is for the entire policy. But it would be $25,000 per person, which would be 5 times the level of cap that we have in Pennsylvania. And Michigan right now at unlimited, just to put that in contrast, so right now it's unlimited, de-insurance would give $275,000 worth of coverage, which would still be the highest in the country, and that $25,000 per person would still be 5 times the entire state of Pennsylvania for the exact same law of no fault.
So the other piece of that, the way it is written now, is that the $25,000 covers your entire family. And that's
okay, so there's a debate as whether it's a person or family, so that's number one.
It's also important to understand the $275,000 number is for your immediate acute care, immediately in the hospital, until you're able to be transferred out of the hospital, not just out of the hospital, but to a rehab facility. But once you're stabilized, but that is for all of the family as well. And the important thing to understand here, this is a major shift of these folks, because $25,000 doesn't buy you much medical care.
It's a few x-rays.
You're then going to go on the tax rolls, and the taxpayers are going to pick up the tabs for all of these accident victims who currently now are picked up by the insurance industry. So it'll be picked up by the taxpayers. It's a big shift.
I've heard stories, too, about when people are in auto accidents, they go to hospitals and they're having x-rays and things, the cost is, you know, 300–400% higher than if they just went in on their own to have the same thing for some reason. Isn't that part of this problem here?
Yeah, the biggest problem is that what's happening right now under the current law that's antiquated, it's 41 years old, is the fact that auto insurers are basically being bilked and charged 4 to 5 to 6 times what these same exact hospitals and doctors agree to take for that same exact treatment in that same facility, just because an auto insurer happens to be paying the bill. That's the problem.
Why not go after the medical providers? Why not? I mean, in terms of what they're able to charge. Why? I mean, has that been part of this conversation, and why isn't it?
Well, it definitely should be. That's called a fee schedule. So basically, with Medicare and Medicaid, every doctor gets paid a reimbursement based on a schedule. In most states, workers' compensation have the exact same schedule. It says if you want to do workers' compensation and you want to treat a patient, you're going to get paid X, Y, Z, volunteer or not volunteer to do it. So in this particular state, there's been a problem because those healthcare providers are scared stiff about actually being able to contain what they're getting paid. Yeah. And that's where the abuse starts.
Yeah, so Eric, you did this in New Jersey. In fact, that was the genesis of your company, right? You went through, New Jersey was going through the same sort of thing Michigan is right now?
Yeah, so in 1990, basically New Jersey was in the same ridiculous crisis that Michigan is in right now. And they were the last state to actually have an unlimited PIP law, almost identical to Michigan. And that's when our organization was started in 1990. And 25 years later, after putting caps into place, giving people choices to choose as low as $15,000, we have a very competitive marketplace. Michigan still has 21% of its drivers in the whole state that can't even afford car insurance.
What's important to understand is that New Jersey has the highest insurance premiums in the entire United States. Michigan is 7. I think that saying that Michigan is in a crisis is a misstatement. Detroit premiums are in a crisis. The rest of Michigan is not. Michigan's lived successfully for 43 years with this no fault. But why is it that one city is so much higher? It's because the insurance companies are allowed to charge within those zip codes of Detroit whatever they want, and they do.
This has been an age-old problem of redlining in Detroit, looking at income, looking at things that have nothing to do with your driving record or anything else in determining rates, right? You saw that as well in New Jersey.
Right. I mean, they're definitely using education, occupation, and credit scores. I'm vehemently against what our industry does regarding that. I think it's abhorrent, and I think it needs to be stopped. I've helped support bills to ban the use of education, occupation, and credit scores, but that's still not the issue here. The issue here is in Detroit, the 5 largest auto insurers in Michigan priced out what the average price was per policy. It's $6,228 for a policy in Detroit. So yes, this bill is only a choice for Detroit people. That's first off, so it wouldn't affect the rest of the state. But it's only a choice. People need to see what happens when you put a cap into place.
David, you get the last 10 seconds here.
Why is it $6,000 when some of them can sell it for $2,300? That's the question.
And there's a lot more conversation about this. I'm not sure we're going to come to a conclusion on all this here, but thank you so much. I'd like to have you back again to talk about this again. And just one real quickly, any idea in terms of when this legislation might pick up?
My understanding is anywhere in the next 2 to 4 weeks, it's going to be a hotbed item.
Okay, hopefully it's not like Rose where it sits there for years and years, one way or the other here. Gentlemen, thank you so much for being here. Really appreciate it. And we're back with the Michigan Matters